welcome to Health Live at Seniors Today. It's a bright Saturday evening, and we have here with us once again our good friend and one of the country's best known liver specialists, Dr. Chetan Kalal. Dr. Kalal is Program Director, Hepatology and Transplant Medicine at the Nanavati Max Institute of Liver, Pancreas and Intestine Transplantation. Widely regarded, as I mentioned, one of the best liver specialists in the country. He has been a recipient of several awards, including the coveted AASLD Foundation Award in 2016 and 2017. Apart from a variety of degrees that he is one of the first DM in hepatology. And his experience ranges from Nanavati Hospital that he is in right now. He also consults at the Beach Candy and Saifi hospitals. And in the past, he has been at the Reliance Global, the Institute of Liver and Biliary Sciences in New Delhi. He was an assistant professor at the V.K. Patil Institute of Medical Sciences. And he was, of course, also at the GS Medical College. He has published over several articles in international and national journals and been involved with several clinical trials, including new drug development, etc. And apart from the other various articles that he's written, I must tell you that we have been privileged to have published him in Seniors Today in our cover story on liver. We wanted to have Dr. Kalal for a few weeks because World Liver Day was celebrated earlier last month. And it's on that occasion that we have this special session with Dr. Kalal. How are you, Doctor?
I'm good, sir. How are you?
We are well. Thank you. And I was reading the other day that the World Health Organization has said that COVID is over. Is that a reality, or it's still there's still some worry around?
It's still a worrying thing, sir. There are certain cases still, getting detected. So it's not completely over, but obviously it is at very low level. So we still have to follow the universal precautions.
Absolutely. Doctor, today we requested you to speak about liver transplantation, when it's necessary and what to expect for seniors. So without any further ado, I would request you to make your presentation. Those of you who have questions, as always, please put them in the Q&A tab, and we will address it to Dr. Kalal after his presentation. It's a very detailed presentation. I've seen a bit of it, and I'm sure you will enjoy it. Over to you, Doctor.
Thank you. Thank you. First of all, I would like to welcome all of you, and thanks for having me here and giving me this opportunity. So Pradyuman was just mentioning that recently we celebrated World Liver Day. So every 19th April is celebrated as a World Liver Day. Are my slides visible?
Yes, they are.
Okay. So every year we celebrate World Liver Day to create awareness about liver disorders amongst the general population. Okay. We are very proud to say that this day was started by India in 2019. So we recently started, and we are getting a good response. Even on the global forum, even all the global bodies, they are supporting us, considering the overall burden of liver disorders. Every year there is a theme. So this year's theme was be vigilant, do regular liver checkups. Fatty liver can affect everyone. So on this note, I would like to ask you, how many of you know your liver status, and when did you check it last? I think all of you must be knowing your liver status. Being a senior citizen, I think all of you must be doing a regular health checkups, because before joining the session, me and Pradyuman, we were just chatting, and I came to know this is a very aware crowd and very learned crowd. So with this, without wasting your much of time, let's start today's session. And I have been asked to talk about liver transplantation. when it is necessary, and what to expect for seniors. Before that, I would like you to see this video. This will explain you how is the liver functioning, what are the causes of liver damage, and what happens when the liver fails. Okay, and then we will proceed further and we'll talk things in detail.
Cirrhosis. That's the medical term for scarring in the liver. Cirrhosis can impact many parts of your life, but having the right knowledge and support can make living with it easier. Before we talk about cirrhosis, let's go over some things about the liver. The liver is one of the largest and most important organs in your body. It's like a factory that does hundreds of jobs. Medicine and all the things you eat and drink travel from your stomach to your gut and then into your blood. Your blood gets to the liver through a large blood vessel called the portal vein. In a soft, healthy liver, blood flows in easily, like water from a hose pouring into a sponge. Now, the factory work begins. Your liver takes things to store for your body, like sugar and vitamins. It also takes out things, like toxins and bacteria. It breaks down medicine so your body can use it. It makes proteins that help your blood clot. And it makes bile that drains out of your liver through small tubes called bile ducts. Bile travels to your gut, where it helps you digest food. Many things can damage the liver. Alcohol is a major one. Having too much fat in the liver can damage it too. This happens to people who are overweight or have conditions like diabetes or high cholesterol. Viruses like hepatitis B and C can also cause damage. There are genetic diseases passed on through families and other diseases that make your immune system attack your liver or bile ducts. Whatever the source, damage to the liver can cause scar tissue. Over time, this shrinks and hardens the liver. This is called cirrhosis. If you've been diagnosed with cirrhosis, you'll be wondering what to expect. Cirrhosis has 2 stages. For most people, it gets worse over time, but treating the cause, like quitting alcohol or getting rid of hepatitis C, can help a lot. The early stage is called compensated cirrhosis. In this stage, some people have symptoms like low energy or feel really tired. Others have no symptoms at all. In fact, it's really common to have compensated cirrhosis for years and not know it. Remember, in a healthy liver, blood flows in like water from a hose into a sponge. Now imagine the sponge is hard like a rock. Water can't flow in easily and pressure builds in the hose. Just like with the hose and the rock, pressure in the portal vein builds when the liver gets scarred and hard. This is called portal hypertension. Pressure buildup can spread to nearby blood vessels and make your spleen bigger. When you have a big spleen, it can take longer to stop bleeding, and you can bruise easier. These symptoms are also part of the compensated stage. If the pressure builds too high and the liver can't do all its factory jobs, you can have major complications. This includes fluid buildup in your abdomen or belly called ascites, or bleeding from swollen veins in your esophagus, your food pipe, called variceal bleeding. Forgetfulness and confusion can be another complication. This is called hepatic encephalopathy. If you get any of these complications, the stage is now called decompensated cirrhosis. At this stage, you'll need to work more closely with your healthcare team. Depending on your age and other medical conditions, they may even suggest a liver transplant. No matter what stage your cirrhosis is at, having the right knowledge and support can help.
Okay, so this video has actually made my job very easy. It was very explaining video. It was self-explaining video, which has already explained everything about. But those who are not attended or paid attention to that video, let's go and understand the natural history of liver disorders. So naturally, liver is like a cake. It is very soft and spongy structure. We have already seen the causes that damages liver. So from being a soft and spongy structure, because of the causative agents, there is an injury to liver, and that injury is ultimately lead to the development of scar, and liver becomes hard, and the hard liver is known as a cirrhosis. So once you develop hard liver or scarred liver, so it can behave in two ways. For example, in early stage, liver is scarred, but the function is preserved, which is known as an uncomplicated cirrhosis or compensated cirrhosis. The next step is liver is scarred, hard, but function is also affected. That is known as a complicated cirrhosis. So here we are talking about two terminologies, one with a preserved function and one with a deranged function. And obviously, when the function is deranged, you are bound to get complications. And what are the complications of liver cirrhosis? Obviously, jaundice, encephalopathy, that is altered mentation or liver coma, then bleeding either through nose, mouth, or per annum, or ascites, that is water inside the tummy. So these are classical complications of cirrhosis. And as we know, once you reach this stage, it is known as a advanced cirrhosis or less cirrhosis. And this is the stage where transplant is indicated. So in short, normal liver, hard liver with the preserved function, hard liver with compromised function, and ultimately either you can develop liver failure, cancer, or death. So this is the natural history of liver cirrhosis. Again, why it is important to know uncomplicated versus complicated cirrhosis? Because if the cirrhosis is uncomplicated and if you take good care of it, the overall survival without liver transplantation is 8 to 10 years. But the moment you develop complications, the median survival without liver transplantation drops down to 1.6 to 2 years. That's why it is important to understand and differentiate between complicated versus uncomplicated cirrhosis. So medically, apart from the symptoms like decompensation, jaundice, ascites, coma, or bleed, there are various scores that medically your doctor can determine. Even these scores are available online and you yourself can also calculate. So first score is called as a MELD, which is nothing but model for end stage liver disease. And so it's a basically mathematical formula that based upon certain parameters, and those parameters reflects the liver function. Okay, so when the score is more than 15, this is the time when transplant is considered. And the other scores, again, it based upon various parameters. And when the score is 9, we consider them that these patients are should be considered for liver transplantation. So we don't want to go into details of that. For simple purpose, there are two basic formulas to understand, apart from the symptoms, whether patient is a likely candidate for transplant or no. So when the male score is more than 15 and the child score is more than 9, this patient should be considered for transplant. Again, why it is important, the scores, these are the two slides. I don't want to go into details of that. But apart from the scarred liver, what are the common indications for liver transplantation? So earlier video, we have seen that there was a normal liver, which because of some insults become hard, and that hard liver failed, and that is the commonest indication for liver transplantation. But apart from this, there are various other reasons that can merit liver transplantation. So none other than the next indication is acute liver failure. So as name suggests, it's an acute liver failure. So suddenly, because of some insult, liver fails suddenly. Okay. So remember the difference between chronic liver disease or cirrhosis versus acute liver failure. Acute liver failure, the underlying liver is normal. it's not cirrhotic, it is not scarred, and it fails suddenly. So this is the difference between these two entities. Again, the second indication apart from cirrhosis is acute on chronic liver failure. Again, here the word itself is self-explanatory. Acute is something acute. C is for chronicity, and LF is liver failure. So basically, patient is a known case of chronic liver disease. He is suffering from it. He is not aware of it, and suddenly some acute insult happens and liver fails. Third, we have already seen cirrhosis with complications. Fourth indication is liver tumor or hepatoma or hepatocellular carcinoma. Again, whenever we think about cancer, first thing that comes to our mind is few days. Okay, but let me tell you, liver cancers are the only solid organ cancer that can be completely cured with the liver transplantation, and this is the only cancer that can be treated with transplantation. Okay, provided there are certain criteria for it. But remember, if you see any person, patient, your near and your dear ones, your relatives, if they are suffering from hepatocellular carcinoma, please refer them to a hepatologist or liver specialist rather than an oncologist or oncosurgeon, because whenever oncologist comes into picture, they will always give you medications, and medication, their intent is palliative. So what I mean by palliative is we are talking about few months, 2 years, but our intent should be curative, where it's a complete cure rather than palliation. And there are certain disorders, metabolic derangement, which usually we don't see at this age group. At senior stage, we don't see this metabolic derangement, but classically Wilson's disease, where there is the problem with copper excretion, and this copper gets accumulated in the liver and that damages liver. So this is not for you people, but these are the commonest indication. Now, there are certain circumstances where the transplantation is not run of the mill. We have to consider these circumstances on an individual basis, on a case-to-case basis. So there are first two indications. Again, they are very much clinical, and I think these are not appropriate for this audience. But the third indication, yes, patient over the age of 65, we have to pay extra attention, because as the age advances, there are certain diseases that comes with the age, especially the heart disorders, vascular disorders. Okay, so even if you are over age or elderly or age 60 plus, still can be transplanted, provided there is no major organ involvement and lifespan is obviously more than 5 years. Okay, again, we have talked about patient with hepatocellular carcinoma. Now, coming to that, we have seen the indications. Now, what are the contraindications, or when it is too late to consider these patients for liver transplantation? So apart from the causes mentioned, I would like you to understand that liver transplantation cannot be offered at the pre-terminal stage. Yes, it cannot be offered at the pre-terminal stage. So choosing an appropriate time is very necessary when you are in a condition to be transplanted. So these are medical reasons. And for seniors, I think extrahepatic malignancy and severe cardiopulmonary comorbidities can be the limiting factor, because as I said, as the age advances, there are certain diseases that comes with the age. For example, as the age advances, the chances of getting detected with the cancers, they are proportionately rising. Similarly, heart attacks, strokes, lung issues can also follow the age. Okay, now after understanding that contraindications for liver transplantation, now coming to a stage to understand how the flow and what is the process of liver transplantation. So first question that arises, that where does the new liver comes from? So there are two ways by which you can get liver. One is cadaveric, that is deceased donor, that is donation after brain death. Yes, so somebody who dies and liver is healthy, so after familial consent, these donors can be considered for liver transplantation. And the second is live donor liver transplantation, commonly known as LDLT, where your family members donate a part of liver. Again, here, as I highlighted, age usually is not the limiting factor. So even in the 80s can be donated provided your liver is normal, and even in the 80s liver can be transplanted. So these are quite gray areas for, and we have to take decision individually based upon case-to-case basis. But I have seen patients getting transplanted in their 75s. Even my oldest patient, which I cannot name here, a very famous personality, he was transplanted at the age of 78. So yes, transplantation can be done even in the late age, and it can also liver can also be donated even in the late age. Again, important thing I would like to stress upon is the cadaveric list cannot be manipulated. So basically, when you are listed for cadaver donation or deceased donor, then we cannot manipulate list, and unrelated donors are not entertained. Basically, so someone who is financially very much affording, and they cannot just bring their servants or known to or someone who is needy and ask them favor and get away without the family members being donated. So no unrelated donor. In case of live donor, has to be from family, and that to close family members, either a first degree preferably or second degree. And remember, if you are listed on cadaveric program, it is controlled by a central body, and the list is not manipulated. You cannot jump the queue. Here in Maharashtra, it is first come, first serve. So first come, first basis. Now the next question is, so according to me, this is a 3-step process, transplant. First step is outcome of the transplants, because people, they still think that liver transplantation is something which is not very successful, and they still feel that if you are undergoing transplantation, you are likely to die. Let me tell you that first successful transplantation was done in 1967. Okay, and it's almost 60 years of experience. In last 10 to 15 years, the technology has advanced, science has advanced, and now we can do a transplant with a success rate of more than 95%. Yes, the success rate of more than 95%, which is as good as any other surgeries, be it cataract, be it appendix, be it tonsils. So despite being major surgery, success rate is more than 95%. Second step is costing. So this is not like a cataract or a appendix where 50,000-60,000 you can get away. So being a major surgery and the 2 operations simultaneously, it usually costs you anything between 18.5 to 20 lakhs. Okay, so again, this I already discussed that in case of cadaver listing, we have to list through a proper channel, and there is a central system known as the ZTCC, which is nothing but Zonal Transplant Coordination Center, and where we have to submit the necessary documentation. Government body will assess that and list you. So once you are listed, after 7 days, you will be given number, and that number is reflected. It's very transparent, and you can see that number and you can follow that number. So on an average, waiting period on the waiting list is 1 year plus minus 3 months, depending upon your blood group. And as I said, the allotment is first come, first basis. And as against live donor, once the donor is there in the family, we can work up the donor. And when we feel that donor is suitable, then immediately within 4 to 5 days, once the necessary documentation is done, liver transplantation can be done. So the next question that comes to our mind is, which one is better, cadaveric or live donor or living? So let me tell you, my dear friends, both, be it cadaver or be it live donor, both of them, they have an equal efficacy, success rate, failure rate, everything is same. There is no difference. So what is the difference between two? So only difference between two is timing. Okay, so choice of transplant will be dependent on the urgency of transplant. As I said, for cadaveric transplant, there is a waiting period. On an average, that waiting period is 1 year plus minus 3 months. And based upon your waiting list number, you will get the preferences. And it is first come, first serve. But in live donor, suppose there is an urgency, which will be there in cases of acute liver failure or acute and chronic liver failure, when or in cases of cancer. These are the few areas where urgency of transplant is there. In that case, the live donor is the option that can be explored. So there is no difference between the two types of donations. Only choice will depend upon urgency of transplant. Now, again, the next question that comes to our mind is that live donor and who can donate. So here, before we discuss the eligibility for donor, let's understand that liver is the only organ in the body that can regenerate, that can regrow. Okay, so liver has two lobes. Right lobe is 60%, left lobe is 40%. For us to live, we require only 20%. So what we do, when we feel that donor who is anywhere between the age group of 18 to 50 years, who is blood group compatible, yes, mind you, unlike kidney, liver requires only blood group matching, nothing else is required. For kidney, you require, apart from blood group, you require genetic makeup, genetic matching, HLA typing and all that. Liver being an immunoprivileged organ, we don't require stringent matching except for the blood group. So donor who is a blood group matched, compatible, anyone who is between the age group of 18 to 15, this I'm talking about live donor, between the age group of 18 to 15, close family member, preferably first degree, and in certain circumstances, second degree can also be considered. Okay, who is fit enough to donate. So what we do, we investigate donor first, and when we feel that donor is suitable to donate, then what we do, we take out 60% from the donor and 40% will be left in the donor. So for us, as I said, we require 20% to live, and we leave 40% in donor. So what is required? We leave double. So 40% in the donor, 60% will be transplanted into recipient, and his 100% will be removed. So 60% in recipient and 40% in donor will become 100% in both of them within 6 to 8 weeks. Yes, within 6 to 8 weeks, liver will regrow in both of them to 100%. Okay, so this is the beauty of liver. Again, the question that comes to mind, what will happen to the live donor, the one who is donating? So let me tell you that it is one of the safest operation. The risk is negligible. Okay, there is no life risk, and the success rate of donor operation is 99.99%. So risk is 0.01%. So this is the risk with which all of us will live. We go to bed in the night, what's the guarantee that we'll wake up in the morning, but we still sleep? So this is a faith with which all of us we are living. So let me tell you, after 3 weeks, donor can join their duties, and after 6 weeks, they can do anything. Donors personal, professional, married, sexual lives, they are normal. They are not affected. Okay. And even unmarried females can donate to their recipients, and they can get married and they can also have babies later on. Okay. Now the next question that I think you should understand is that life, post transplant. So here the key is immunosuppression is for rest of your life. About the amount and dosages of immunosuppression, they are lesser than the kidney. As I said, liver is one of the privileged organ, and it is very immunoprivileged. It is very immunological friendly or privileged organ that requires a bare minimum immunosuppression. And always there is a fear of rejection. Okay, so let me tell you, rejection is not a feared complication anymore with the available new treatment. In fact, if you want to ask any complication that you can choose, you can always choose for rejection, because that is easily treatable. And within 6 to 8 weeks, as I said, recipient can lead a normal life. He will be what he was there even before becoming a liver patient. So life will come back to the normal after 2 weeks, after 2 months for recipient, and after 3 weeks for donor. Again, you will be on long-term immunosuppression. Initially, the number of immunosuppressions will be high, but as after a year, only single, or in certain situations, depending upon the reason for transplantation, there can be a 2 immunosuppression, and immunosuppression has to be continued lifelong. Cost, I have already talked about. This is a very old slide, but I kept it for you. That look at the survival. The survival post-transplant, so this is, in early 2000, where transplantation was not that widely appreciated. Okay, so still the 5-year survival is 75%. And if you remember that once the decompensation is there, median survival is only 1.6 years. So compare 1.6 years to 75% at the 5-year. Though this is the old data, nowadays, as I said, even the long-term survival is more than 80%. In fact, when we counsel patients, we tell them that not a single day of your life will be taken away by this. So you can live normal life, whatever God has given to you. Now, coming to the specific issues that can arise in elderly, this we already talked about, but just to mention certain other parameters, that apart from cardiovascular problems at this age, there can be a functional problems like sarcopenia. Sarcopenia is nothing but loss of muscle mass. Okay, so many seniors or elderly people, due to advanced age, they tend to lose muscles, and the term is known as a sarcopenia or frailty. So frailty is loss of function, and sarcopenia is loss of muscle mass. And liver patients, I don't know whether you were attentive during that video, but in the video, it has clearly shown that liver is a site where all the proteins are produced. Now, since the liver is compromised, its functions are affected, then the proteins are not synthesized, but body requires proteins. Muscles are the source of protein. So what body does? Body eat proteins from the muscle. That's why your muscles become very, 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 very flabby, or there is a muscle loss, which is known as sarcopenia. Malignancy, we have already discussed. With advancing age, the chances of malignancies are very, very, very high. Okay, so we have to be particularly cautious while choosing this group of patient. So liver transplantation is a teamwork, where the patient plays the central role or most important part. Then the surgeon, hepatologist, anesthesiologist, then the cardiologist, chest physician, kidney specialist, physiotherapist, psychologist, nutritionist, and the transplant coordinator form. These are the core members of team. And after that, once everybody certifies, then only transplantation can be considered. So coming to the end of my topic, that liver transplantation restores health to the terminally ill. So if you don't have any other option, or medically, if we cannot do anything, then the transplantation is the key. Identification of the complication that we have discussed, jaundice, ascites, coma, and bleeding. We should identify them early, and these patients should be referred at the earliest, apart from the medical scores. Liver transplantation can be life-saving in acute liver failure, acute and chronic liver failure, complicated cirrhosis, even in SCC, that is liver cancers. Commonest indication nowadays are fatty liver and alcohol. And elderly patients may have different risks and benefits based upon the underlying comorbidities. Remember, friends, chronological age is not the contraindication for liver transplantation, because physiological age is most accurate indicator of functional status. Someone, even though his age is 80, say, for example, 78, in one of my patients, he was physically fit. His heart and lung status was mind-blowing. So we consider him, obviously we explained high risk about the liver transplantation, but we could transplant him and he's still doing well. So this was done somewhere around 2017 or 18, and it's 5 years and he's still living a very good, active, healthy life. So elderly recipients, especially more than 60 years, with the risk factors like blood pressure, diabetes, kidney issues, they are likely to have a more protracted course. They are likely to have more complication. So we need to select those patients carefully, and more additional tests we need to do. Again, I told you that there is a waiting list, and unfortunately, majority of them, they die while on waiting list. So maintaining waiting list is quite a tough task, and cadaver donation is the need of the hour. So with this, I think I will stop here. Thank you for your patience hearing, and I welcome questions now.
Thank you very much, Dr. Kalal. It's a very detailed presentation. Thank you very much, Dr. Kalal, for this presentation. Before we continue further, I'm going to, on the chat window here, I'm going to put up the article that Dr. Kalal had written. It's there on the chat window. That is Love Life, Love Your Liver. And, today Dr. Kalal has spoken about liver transplant, but he had come here in the past as well, and where he spoke about liver care in general. And that link is also there on the chat window. So you can see both the links, and well, some of what he said is the same, but there's a lot which is different. So you can go ahead and see that as well. Doctor, there are quite a few questions that have come in. There are 6 questions on fatty liver. And so I'll take the question by Mr. Kamal Sethia. He says, I have a fatty liver. Doctor has suggested a liver scan. Please suggest, will that help?
Yes, sir. Thank you for this question. Fatty liver, I think we have discussed last time, but I'll just briefly tell you that scan is important, because fatty liver is a very vague term. You need to understand what stage your fatty liver is in. Basically, if you see the spectrum of fatty liver disease, so it's basically just a fat at the beginning. Then because of fat, there is a damage, and it can lead to the inflammation, which is in the middle, fat and inflammation, and ultimately scarring. So you need to know at what stage you are in, because treatment will be different in each stage.
All right.
So scan will help you to understand what stage you are in.
Thank you. We have a question from Mr. Sudhir Srivastav. He's 63. Should I say he's just 63?
Yes.
You said the liver regenerates in both the donor and recipient in 6 to 8 weeks. In a normal human being, does the liver go on growing, and up to what size?
It goes to normal size, sir. It becomes 100% of its size in both recipient and donors.
Right. Now, there is a question from an anonymous attendee. Well, actually, Mr. Bharat Mehta, who's 66. His question is, how should one keep liver healthy? But I have 2 more questions that have come in. Doctor, how harmful is alcohol. I have been drinking for the last 30 years and it's impossible for me to stop. How much can I have on a daily basis?
So, sir, I think we have discussed this last session also. Alcohol is always, something that is misused, and there are various myths associated with the alcohol consumption. First myth, I'll tell you that people think that soft drink or a beer, they are not harmful as against the hard liquors like rum, whiskey, gin. So let me tell you, alcohol by any name is alcohol. It's just the concentration that differs between the different drinks that you drink. So it's the amount of alcohol or percentage of alcohol that is more important than the type of alcohol. Okay. So basically, it is just the concentration that is different in different types of alcohol. So ultimately, the damage is dependent on age of the onset, type of alcohol, amount of alcohol, then binge drinking, then total duration, and the risk factors like genetic risk factors, then enzymes, which normally when we drink alcohol, okay, there are certain enzymes which metabolizes that alcohol. So based upon their interactions with the alcohol and ultimately age. So these are the factors will decide. So long story cut short, alcohol is injurious. So there is no safe limit. And if you are drinking it daily, you are definitely going to get some effects, sooner or later. Usually, typically, when the alcohol intake is significant, especially more than 20 years, we say that this is the significant alcohol intake, and you will bound to get alcohol-related injuries, sooner or later. So better to stop it, and there is no safe limit.
So, doctor, this is a question that has come in from the same person who said 20 years he's been having alcohol. He says, doctor, two things. One is that I keep taking my tests every year and my liver function test is absolutely clear. And his second question is that, is it, you just said about enzymes, he just sent his question, you just sent about enzymes, is it good to have certain kind of foods before having alcohol, or what would you recommend? Sorry.
Okay, sir. So I will answer your second question first, that there are no foods that will prevent alcohol-related injury. And I would strongly say no. No means no. Like Amitabh Bachchan says, no means no. So no to alcohol. And coming to your first question, what was it? He is taking regular. Yeah. So let me tell you, as I said, liver is a very unique organ in the body. It regenerates. So you are taking alcohol. Alcohol is reaching to liver. It is damaging. But since there is a regenerating or repopulating capacity of liver, the damage is getting repaired. So this cycle will continue till the time you reach to a limit. For example, elastic, you can stretch, but at one point, once you reach that break point, it will break open. Similarly, you will start noticing damage only when the functional capacity or regenerative capacity of liver is overwhelmed. And your second part of the question, that you are taking a regular test and they are normal. So my dear, let me tell you that even with the significant damage, there won't be any signs, symptoms. So even if you have, normal enzymes, it doesn't mean that your liver is not getting damaged internally. So even with the significant damage, there will be no symptoms, and all the tests, including liver function test, will be normal. So, and by the time you will come to know, it will be end of the road. There will be nothing.
That's a very important point, because what you're saying is that even if I do my LFTs regularly, it may not necessarily be a good indicator if there is some kind of damage that is happening inside. It may not show up anything whatsoever.
Yeah, it's like a Dimak. No, we say that Dimak ne andar se khokla karta. It is like that. Externally, everything is okay, but internally it is not. The same thing is happening inside the liver, and that is purely because of the self-healing property of liver. So damage is getting auto-corrected. But as I said, it will correct up to certain points. Once that capacity is overwhelmed, immediately it will. So typically, these are the cases, those who will present like ACLF, acute on chronic liver failure. So there was a background damage, and suddenly some insult comes and liver fails. So this is how typically this group of patients will present.
Doctor, quite a few questions have come in. I'll just go quickly with them. This is the first is from Lax. He is our regular on Seniors Today. He's age 68. I have signed up with organizations called Mohan for blood donation. I gather that one can help at least 8 people with organs and skin. I'm not sure if liver of a sugar patient can be transplanted.
So you're talking about live, I mean, you being
donation, yeah.
Yeah, so basically, sir, as I said, even NASH is the commonest indication for liver transplantation. And NASH is basically fatty liver, where diabetes is the important factor. So per se, sugars is not a contraindication for liver donation or transplantation. There are various indications and contraindications those who can donate. But at the time of donation, prerequisite is patient has to be inside the hospital. It is not like that I have signed a pledge where I can donate the organ and I'm at home. If something happens to me and I'm at home, I cannot donate my organ.
Right. Thank you. We have a question from Katie Dadanchi. It says, Doctor, do tablets like statin and blood pressure tablets taken for a long time damage the liver? And does and the second question that she's asked is, does fatty liver lead to cirrhosis in the long run?
Yes. So again, I will answer your second question first. Fatty liver is one of the commonest cause. In fact, it is more commoner than what we used to think, and it can certainly lead to cirrhosis in long run if the risk factors are not controlled. And blood pressure medications and statins, for that matter, it depends upon what kind of blood pressure medications you are taking. So if you are taking medications like amiodarone, if you are taking medications like hydrochlorothiazide, in established cirrhosis or when there are certain risk factors, these medications can damage liver. And what was your second question? Statins per se, in indicated patient, they don't cause any liver damage. But sometimes when there's ongoing liver injury, and statins can worsen that injury in select group of patients. So there, those who already have a liver injury and on statins should be carefully monitored for their liver function.
Right. Thank you. This is a question from Mr. Babulal Todi, who says, he hasn't mentioned his age, but I have been advised Maxiliv because I have lung fibrosis and take Nintana 150. What is the impact of Maxiliv on liver? He asks.
Okay, so sir, your question should be other way around. Nintedanib can affect liver function. Maxiliv is nothing but glutathione. It is antioxidant and it is very, very safe, but only when for short period of, you cannot continue to take glutathione or antioxidant for the rest of your lives. So it is only indicated in a situation where there is an ongoing active inflammation, where there is an oxidative stress. So you can use antioxidants, for rescue for short period of time. And as I said, nintedanib is something that you have to be careful. You have to monitor liver function periodically, and you have to titrate the dose if at all liver function is getting affected.
Right. Doctor, there are a couple of questions that have come in about fatty liver. What kind of medication, what kind of natural stuff that one must take for fatty liver? Is there something that you can give a overall kind of advice to somebody who may have fatty liver, but it's not really causing a problem? So what should she or he do?
So basically for fatty liver, broadly, you should try to understand what fatty liver stage you are in. We just discussed, it is just a simple fat or inflammation, or fat inflammation and scarring, because all these stages will not give you any signs, will not give you any symptoms, and by and large you'll be asymptomatic. So first and foremost thing to understand and know the stage what you are in. Second step, whatever may be the stage, whatever may be the step. First thing that you should do is diet control. Okay, basically you should avoid bakery products, maida products, adopt a healthy lifestyle, try to maintain your ideal body weight, which is nothing but height in centimeter minus 100, and avoid alcohol, avoid hepatotoxic drug or liver damaging drug. And there are no as such natural remedies that can prevent this. So basically you have to control the risk factor. So the key is diet and exercise and maintenance of ideal body weight.
You. There's a question from Mr. Ramesh Desai. He says, is there any, his question is, any special care required by a lady diabetes patient who's 72 years old for the liver? I understand some muscular problem for such patient, like indigestion. I don't know what the second part of the question he means, but the first one, is there any special care required for a lady who is 72 and for the liver and she has diabetes?
So anyone who is diabetes, especially when the duration of diabetes is more than 10 years or whose HbA1c is more than 7.5. So they are likely to get fatty liver disease, 80% chance that they will get fatty liver disease. So they should do a periodic sonography at least once in a 6 month. They should do a periodic liver function test, that is at least once in a 3 months. And care per se is you have to control your sugars and the other associated risk factors like blood pressure, cholesterol, and if you're sedentary, then you should be active. These are the care that you can take, especially when you have diabetes of long duration.
Right. Doctor, there are a couple of questions about, there's one question, one question that person has said very nicely, or what is general impression, which is from Mr. Lakshmi, and he says, by default, whenever we talk of liver failure, we think of someone who was a drunkard. But besides alcohol, what are the other reasons for liver damage? I know you've touched upon this earlier, but as a one last question, could you?
Okay, sir. So this is a very nice question. I would say, in fact, most of the time, the notion goes that whenever we talk about liver, we talk about alcohol. Alcohol and liver goes hand in hand. If you tell someone that you are suffering from liver disease, the first thing that will come to his mind, oh, you must be drinking. So this is how common or prevalent, alcoholic liver disease. But let me tell you that apart from alcohol, in fact, commoner than alcohol is something called as a metabolic syndrome, which is nothing but the constellation of diabetes, blood pressure, visceral obesity, cholesterol, sedentary lifestyle, family history of diabetes, family history of blood pressure. Okay, all these things put together, we label them as a metabolic syndrome, and this is the commonest cause of liver damage, not only in India, worldwide. In fact, by 2030, India is going to be a hub, because by 2030 we are going to be hub for diabetes and blood pressure. Okay, and as I said, these two conditions, it forms the major part of metabolic syndrome. So metabolic syndrome is the another significant cause of liver damage apart from alcohol. Then there are viruses like hepatitis B and C. Again, common in India, complementary and alternative medications, Ayurvedic medications, homeopathic medications. Then autoimmune conditions where body's own immunity is acting against self. Then genetic factors, metabolic conditions. Then involvement due to other conditions like heart failure or kidney failure, or there is a secondary involvement of liver. So these are the various common factors that can cause liver damage apart from alcohol. Though there can be more than 100 causes, but these are the commoner ones.
Thank you, Doctor. Thank you, Doctor, for spending so much time today. We've far overshot time today, but you've answered so many questions. You've given us a very detailed presentation. And, I was speaking with Doctor just before the session started, and he was mentioning about how the new statistic is that almost 1 in 50% of people have some problem with the liver, right? Is that right, doctor?
Yeah, that's why this year's theme, be vigilant, do regular liver checkup, and fatty liver can affect anyone. This is this year's theme. So that precisely tells you that prevention is better than cure, that we already known. But now there is a time that we should follow this notion. And as mentioned in the theme, please go and get your liver checked today. And if you have risk factors, especially like diabetes, blood pressure, please, you should definitely go and seek a medical attention and try to check them periodically and keep your liver healthy.
Doctor, I have one more question. Doctors like yourself who are liver specialists, are you all essentially attached to hospitals only? Or because, for instance, with diabetologists, etc., you do have diabetologists practicing from the clinics, etc. But are hepatologists only associated with, attached to hospitals, or do you have doctors outside of hospitals as well?
I have my own clinic also at Vadala, sir. It is next to Ram Mandir, where I sit 6 to 8 daily.
Great. So those of you who have any questions for Dr. Kalal, you can always interact with him via Nanavati Hospital or directly as well. And thank you very much, Doctor, for being here. It's always a pleasure to have you, to interact with you, and to get such detailed responses to our readers' problems and concerns. Thank you very much. For those of you who are here, as you know, we are there every Saturday at 5 p.m. with a session of Health Live at Seniors Today. So we will be back next Saturday at 5 p.m. As always, if you would like to attend, you can pre-register, and we will send you. We will register you, and we will send you a link for all the sessions from the next week onwards. Otherwise, you can just keep checking on what we are doing on our various social media and on our website. Thank you very much once again, Dr. Kalal, for being here. And thank you to the folks at Nanavati Hospital for facilitating this. Thank you.
Thank you, sir. Thank you for having me. Have a nice weekend to all of you.
Thank you very much.
Subscribe now and press the bell icon. Never miss an update.